Hello, it's Dr. Rhonda Johnson, and today is Tuesday, February 28th, 2023, and today I am discussing uterine cancer. Now, uterine cancer is a common gynecological cancer. The incidence seems to be rising in the United States. Experts think that may be tied to risk factors such as rising rates of obesity in women. Now, I want to first say that you have to be born with a uterus to be at risk or to get uterine cancer. And uterine cancer is a cancer that begins in the lining of the uterus called the endometrium. Now, the most common symptoms are related to bleeding. For premenopausal women, this can include heavy or prolonged bleeding or bleeding in between periods. For postmenopausal women, this includes vaginal bleeding after menopause. Now, some women experience pain, fullness, or discomfort in their pelvic area as well. So how is it diagnosed? Well, there are many tests used to diagnose uterine cancer. It includes a pelvic examination by a medical care professional. You can get an ultrasound or MRI as imaging test, but only a biopsy of the endometrius can make a definitive diagnosis. Now, what are the risk factors for uterine cancer? Remember, risk factor is just something that increases your chance of developing cancer. You can have one or many risk factors, and that doesn't necessarily mean you are going to get the cancer. Now, age. Uterine cancer most often occurs in people 50 and older. Uterine cancer is uncommon in younger women. Obesity is a big risk factor because fatty cells and fatty tissue in people who are overweight produce extra estrogen. And estrogen is the hormone that can increase your risk of uterine cancer. Now, race. White women are more likely to develop uterine cancer than women of other races or ethnicities. However, Black and Hispanic women are more likely to be diagnosed with advanced uterine and more aggressive uterine cancer. Now, estrogen, I mentioned, is a big culprit. What are the risk factors related to estrogen? Well, the longer your uterus is exposed, the more higher risk you have. So starting your menstrual periods before the age of 12 and going through menopause later in life can increase your risk. Taking hormone replacement therapy after menopause can increase your risk, as well as never having been pregnant, and if you've taken tamoxifen for breast cancer. Now, there have been some recent studies suggesting that women who use chemical hair relaxers and straighteners may have a higher risk of uterine cancer, and that's related to products in these chemicals in these products that can be cancer causing. Now, what are the treatment? The treatment is surgical. Advanced cancer may involve chemotherapy and radiation. So what can you do to prevent uterine cancer? You know, I start off by saying it's on the rise. So prevention should focus on improving your lifestyle choices, since there's a strong relationship with being overweight and obese. Improving your diet, exercising, and maintaining your healthy weight is important. Also, cancer prevention screening has declined during the pandemic. Women, we have to take care of ourselves, and we have got to put ourselves on our list. So put your health on your list. Try to stay up to date with your annual screenings. Listen to your body. And if something doesn't feel normal, get it checked out. That's my message today. As we close out Black History Month, I have focused on cancer prevention as my area of impact for Black History Month 2023. I want everybody to be in the know how you can be intentional around lowering your risk of cancer. I hope it's been helpful. Leave me a comment. Let me know. Take care, folks.